The miasms and their relation to the pathology, according to J.H.Allen. The fact of the matter is this: when Hahnemann promulgated the science of homeopathy and made it public to the world, it was then a very complete science, and although he had not brought out all the minor details as clearly as we see them today, Hahnemann teaches that the remedy given in each particular case to be able to produce symptoms as like as possible in a healthy individuals. Physiology is the science or theory of function and change in healthy bodies, while pathology has reference to diseased body. There are 3 points to which we could take exception in Dr. Hughes' teaching, especially waiving all the others that might be considered. First, Dr. Hughes was thankful that the law enabled him to fit drugs to a given case even when he cannot give the disease a pathological or man made name. Second point: has pathology any more relation to causes than symptomatology? Thirdly, diagnosis is not always a positive thing, while symptomatology is always positive, and they mean the same to all men, making the law a universal and harmonious thing. Postmortem changes and pathology are not always the end of the miasmatic action or the end of the disease, although they may be the end or death of the patient. We might illustrate this by two cases of pneumonia, for these postmortem changes are neither the beginning nor the end of the disease process. One begins in the right lung, travels to the left, and the other in the opposite direction. On examination of the morbid anatomy, we might find no distinguishable differences. Yet, the phenomena might have been quite similar. Symptoms covering the pathological grouping again then may be entirely different. Pain in one may be sharp shooting, stabbing, while in other there may be comparative freedom from pain, or if any were present, it was in dull character. The exaggerated working of syphilis, as seen in the thick protruding lips and mouth, the irregular and imperfect dental arch, the serrated incisors, the high cheekbone, the large head, and 1,001 changes not to be found in the inner of inner came of simple psoriatic trait. The psychosis was different in past and in today. The increase of psychotic disease, which we know to be greatly on the increase by the suppression of this disease process by the modern powerful suppressive agents in use today, by the imperfect life, diet, and hygiene. Pathology may be death process, but it was first a perverted life process, first a perverted physiology, a perverted function, and functional change proceeds and does proceed all pathology. The true pathognomic symptoms of a given case are those that cover the existing active miasm. This obstructive disease was their fragment of a much more deep-seated was a mere fragment of a much more deep-seated primitive evil, the great extent of which might be inferred from the new symptom, which continue to appear time to time. Symptoms characterizing the whole of the disturbance of was to discover all the ailments and the symptoms inherent in the unknown primitive malady. Hahnemann's recognition of this primitive existence in a chronic miasm is the only true conception of disease. The chronic miasms, syphilis, and psychosis ought to be cured in the primary and secondary stages before they have formed such a perfect bond with sora as to induce tertiary manifestation. Tertiary manifestations are in these diseases permitted to develop principally because we have neglected soric manifestations that were latent before the newborn, now aroused by them into new activity by new stimuli and the bond with the venereal miasm. Mercuric salt for syphilis, the ulcers or the mucus paths, continuing it on and on for an infinite period, while at the time it is acting only as a suppressive and not in any sense as a curative measure, now largely lies in the soric bond and in the soric phenomena, and a remedy may have been selected whose provings cover the present phenomena of both miasms. The true internal nature of disease is made manifest wholly in the study of chronic miasms. Pathology is not at the bottom of that mysterious process by which morbid changes and alteration take place in organism. Although we see no material in potency, it still have the power to disturb the healthy organism in its own peculiar way. We see it first as a rule manifest in the mental sphere, then in the physiology or functional, and then final in the pathological. The pathological, of course, coming last. The disturbances are in accordance with the existing active miasm modified by previous heredity or miasmatic states of the organism.